Hi, I'm Poppy Jaman. I'm the CEO of the City Mental Health Alliance and a trustee at the Centre for Mental Health. I've just finished reading the fantastic final report on the Commission for Equality in Mental Health. And one phrase or statement has really stood out for me, and I'm just going to read that. The phrase is, "We risk continuing the cycle of expanding mental health services without taking action to reduce the need for them." And I was reflecting on why that statement stood out to me or hit home so much. And it took me back about 30 years when I was a teenager, and I was reflecting on my family or social circumstances at that point in time. And we were living in a 3-bedroom terraced house in a multi-generational family, 12 people in that house. So my granddad, my family, my uncle's family, my younger uncle, and my younger auntie. And yes, there is an element of Asians, communities living in multi-generational household because of choice, because of our cultural norms. But in fact, for us, there was also another underlying factor in those living circumstances, and that was necessity. We didn't have a choice because we didn't have economic equality. We didn't have wealth and a huge income coming into the house to be able to afford to live in any other way. And in fact, those circumstances or those lack of opportunities had a huge impact on the three of our lives. So that's me and my brothers. You know, our education was interrupted for several reasons, but one of those reasons was that there was a necessity for us, and particularly my brothers, to contribute to the household income. And so difficult decisions were made between continuing education or getting work as young men. And that then reduced opportunities for them significantly. And then I sort of reflect on where I'm at now, and I think, well, I'm a middle class, privileged woman, as are my brothers. And what is it that moved us from that place to this place now? And actually, one of my brothers, who is the head of workforce development at Health Education England, M. Rahman, he and I often talk about us, our journeys, and trying to sort of embed some of that journey and learning into our children. And we talk about us being good examples of social mobility, and I'll come back to that in a moment. So, you know, I'm a privileged woman, middle class, earning a good income. I've gone and had and got myself an education as an adult, and I am in influential roles, and so, you know, have social status, got a very loving family, and doing okay. So what gives me the right to sort of talk about that now? And I think it gives me the right because there's a lot of learning that I draw from those experiences. But also I feel like if we don't address that phrase or that risk that is highlighted in the report, where we don't take action to reduce the need for mental health services by getting to some of the root causes, then we are being negligent. And me working in the mental health sector and also being a voice of my community, it would be negligible of me to not actually shine a light on my experiences, but also shine a light on now. I'd like to think that 30 years on, those health inequalities or those determinants of health, good work, a healthy place to live, opportunity to education, having an equal voice was no longer an issue. And in the current climate, it couldn't be even, you know, I don't know how to even say this, but we shining a light on these issues have become even more crucial, because the inequality has always existed, and the little progress that we had made is at risk right now. We're at risk of resetting inequalities in a way that has never happened in my lifetime. And I would like to just sort of share some data points on that. I did a review of published research between May and June of this year. And these are some of the things that I found. I found that higher income households have often maintained income and reduced spending, and so saved. Lower income households were more likely to be furloughed, and essential expenditure represented a higher proportion of their income. So the gap between the have and the have-nots is increasing. There has been 2.1 million new universal credit applications. 1 in 5 people are struggling to pay bills, and double that are worried about their finances. The reliance on food banks has doubled in some parts of our country, and 2,500 children were admitted to hospital for malnutrition this year, which was double from the same period last year. Mothers were 1.5 times more likely to quit or lose their job or be furloughed. And a higher proportion of single parents have reported mental and emotional distress during the pandemic than the population as a whole. So if I look at those data points and I reflect back to my childhood, and I imagine what those people look like, is it more women? Will it be more Black and brown people? Will it be people who are at the lowest end of the socioeconomic groupings? Then it is the multiple accumulative stresses on our lives is increasing inequalities, and we are at risk of resetting inequalities. And therefore, we all have to take collective action, and collective impact is really, really, really important. And suppose to that, if I sort of fast forward to where I am now, and I think, well, what were those things that helped me to be in this current position? Because equality and doesn't happen in a vacuum. And I speak to, again, some of the things that the report highlighted: allyship, sponsorship, mentoring. The first big opportunity that came for me to step out of the place that I was at, which was, in my early 20s, a young woman with mental health issues, living in social housing on benefits without hope. And what were the things that happened? The first thing that happened was I got a job, and work played such a big role in ensuring that I was able to have financial health. I was able to have an identity that I was proud of, and I was able to see a future that was hopeful. The second big thing that happened was education, actually. So my line manager then, Fiona, opened a door for me and sponsored my career, not just mentored me and coached me, sponsored my career. And that is different to coaching and mentoring, because what she did is open doors and put me in rooms where my voice, or women like me, were not seen. And she also she encouraged me and sponsored me to go on a leadership program for Black people, Black managers across the health and social care system. And that education was crucial to building my confidence, giving me an insight into how the health system worked, enabling me to connect with other people that were in the health system that looked like me, that I could relate to, and we could develop, and that helped me to develop a group of friends that I still have now, who are my confidants, who are the people that I go to sound out some of the thoughts and reflections and limitations that I might be experiencing in my career, but also in my personal life. And that network would have never been there. But the other thing about collective impact is it is impossible to have representation of our voices. So the voices that the report speaks to, those people that are not heard and that are not seen, and actually even the data isn't there. So we've got a lot of research that are siloed, but the intersectionality of research that is talking about health inequalities and how that connects to mental health is very limited. So we need much more data in this space to be able to build strategies that are future-proofed, but not only future-proof, that lead and guide us into how to develop systems and structures that are going to reduce health inequalities. And that only can happen when we have got systems leaders. So we have got people in leadership positions that are advocating for health inequalities, because they understand that without reducing health inequality, you are not going to have a healthy society. Both of those go hand in hand. And data is crucial for that, but also allyship is really important for that. When I was reflecting on who are my mentors and who are the people that I go to for professional support, and actually nearly every single one of those people are white men. And these are people that have been my bosses in the past. These are people that hold influential positions, and they make sure that when the voices of minority groups or disadvantaged groups are not in the room themselves, they are the allies and they are the advocates that place those voices in the room and ask the right questions to make sure that we are developing strategies that are going to diminish inequalities. I think that's, until we've got a society that is fair and equal, and there is participation and representation at every level, which we're very far away from right now, that collective impact has got to be led by all of us working together. Communities, leaders, government, organizations, local organizations, every part of the system has to come together to enable a future where mental health inequalities is diminished, where we diminish inequalities. And until that happens, we're not going to have a society that is healthy. And so I guess I come back to this statement, you know, we all have to take action to reduce the need for more and more mental health services, because intervention is not enough. We have to prevent and we have to promote, and we really have to be radical and relentless in our expectations of ourselves, our communities, our businesses, our governments to do better.